Hello. So it's been 3 days. We're going on almost 4 days since I had my breast implant surgery. Um, for those of you who don't know, I was diagnosed with breast cancer in February. I had a bilateral mastectomy, and I chose to do the mastectomy with reconstruction. I had expanders put in, and I've been recording my experience with having expanders for the past few months, and now I have had the expanders removed, and I have my hopefully permanent implants in. I know they say that they last 10 to 20 years, um, but sometimes can last, you know, a lifetime. So here's hoping I won't have to have new ones put in 10 or 20 years, but you do what you gotta do, right? Um, my experience with my surgery. So I was a little nervous, having another surgery, you know, um, just we're going on 6 months after my bilateral mastectomy. Um, I've never had a surgery, that close, together before. So I was a little worried about how my body would react, to that. I reached a point where I'd healed so significantly from that last surgery that to have to get opened up again, was very nerve wracking. But it went well. Um, I personally do not do very well coming out of surgery. um, I was nauseous. I had a headache. I was, of course, sore, Um, and for whatever reason, I was having lower back pain and I was cramping. And it was like, why? Why, body? Why do you gotta be so cruel to me? um, but, my husband got me home and I've been on the mend. I've been doing very well. My doctor will not let me take any NSAIDs, so no ibuprofen, aspirin, Aleve, nothing like that. He prescribed me a painkiller with Tylenol, um, and anti-nausea and antibiotics, of course. And I got off of the painkiller about 2 days ago, just because I don't like the way it makes me feel. And I have felt like the pain has been manageable. You know, I'm just taking Tylenol if I feel like it's getting a little more, inflamed or swollen. And that's been working fine, for me. Um, I have to sleep on my back. I can't sleep on my sides, if you're wondering about that. In one of my previous videos, I shared this lovely little orthopedic sleeping device that I got. It's just, I gotta be careful with my arms here. Got my little side pillow here in the way, but I have this kind of prop up orthopedic pillow, and leg cushion thing, and my favorite thing of all, my mastectomy pillow, which has been wonderful also for recovery from after having my implants put in. Um, as you can see, I'm wearing my mastectomy shirt again. I've got two of them. I have a pink one and this black one. This one buttons up and then my pink one zips up. You want to wear shirts that provide easy access, so if you need to change any bandages, you can. My doctor's not letting me. He said that, to leave it alone, at least until my first checkup, which is tomorrow. Usually it's about a week out, but because of scheduling issues, they scheduled it 2 days a little bit early for me. So I'm going to be going in, getting my sutures looked at, and making sure everything's healing well. Um, when I finished with my expanders, I was about 580 cc's. I did ask if we could go a size larger during the surgery, if that were possible. And after the surgery, he told me that my silicone implants, one was 680 and the other one is 700. I know that sounds like they'd be an even, but in my case with my body, it's not. They look perfectly even. And, as far as I can tell, they look perfectly even. So I'm happy about that. There's some biological reason, just the way my body is. I don't know if that's true for every woman, but apparently that does happen sometimes. So whatever the reason there is, I'm in really good spirits today. I'm not feeling as nauseous. My headaches haven't been as bad. I did get a little bit of a migraine today, but I do that anyways. That's just something I do. So, hopefully that's not something you deal with. But if it is, talk to your doctor about that. My doctor told me, in my case, if I get a headache or I get cramping or any other problem, any other regular, body issue pains, that I need to just take the painkiller he prescribed me. I'm trying to avoid doing that. I don't like the way painkillers make me feel. So, but pain management is important. So, um, I'm just kind of sticking with Tylenol at this point. But we'll see how that goes. Tylenol does not do anything for my migraines. So I did have a caffeinated beverage with some Tylenol earlier, and that helped take the edge off of my migraine at that time. So here's hoping we can keep the other biological issues under control while I'm healing from this. So I cannot lift my hands over my head. I have robot arms right now. I cannot do the butterfly movement very far. I have to be really careful, how I move my arms, like how far back they go, how far to the side. My doctor has me not doing any housework. No dishes, no laundry, no vacuuming, no sweeping, no nothing. So my husband and kids are having to pick up the slack where that's concerned. And that's driving me crazy. They're doing the best they can, but I cannot wait to be on the other side of this and be able to get back to as much of a normal daily life routine as I can. Going through this in the middle of COVID-19 and school's about to start and just everything. It's kind of crazy. I'm feeling a little crazy. I'm probably looking a little crazy too. So I apologize if I'm looking a little scary. But yeah, my husband helped me wash my hair the other day. I can't take a shower. I can't sit in a deep tub. I cannot get my sutures wet at all for the next 2 weeks. Ugh, at least. Maybe 3 weeks. So, yipes. I can take my, doctor said I can do sponge baths, like I said, have someone, help wash my hair, to do like a sitz bath and just kind of a sponge bath, with a very little bit of water, and just make sure I keep the water away from my chest area. So, that's really difficult. To help deal with that, I did buy some body washcloths. You can find these, they're very large body washcloths. I've been using those to help, clean in areas that need to be cleaned. I bought some face washcloths as well, to help with my face. Of course, I can, splash my face a little bit. It's kind of difficult with the limited motion. I can't jerk my arms too much. Dry shampoo, but that only lasts for maybe a day or two, and then you've got to wash your hair. I don't know about you, but with me, I have to wash my hair. I get very oily hair. We've also had record-breaking temperatures. The last week has been in the triple digits, and that's been very difficult, with children in the house who need to go out and play, and it's just too hot. They just do not want to go out and play. So recovering from surgery, plus triple digit temperatures, plus COVID-19, plus school about to start. It's been crazy, I just have to say. But, here I am. I'm doing pretty well. And, why am I making these videos? Well, I'm wanting to share my experience. Hopefully these videos have been inspiring and are inspiring and helpful to you, if you're going through breast cancer, if you're facing surgery. I just want to help other women know that, you got this, you're strong. You can do this, it's scary. Yes. And it's hard. Absolutely. But it's not impossible. And in this case, Um, you do what you feel is best for your body, best for your diagnosis, and just hang in there. You can get through this. You can do this. I just want to share that message, with other women. When I was first diagnosed with cancer, I was absolutely terrified, and watching other women's videos really helped me get through that, and helped inspire me to see that my life isn't over. Not yet. There's still life to be lived from the moment of diagnosis to whatever happens. All the in between, there is some life left to be lived, and you do what you can do, and you fight to survive. And I just wanted to share that, and let you know that there's hope. Hang in there. You got this. We're women. We're strong. We got this. I'm excited to be on the other side of the surgery. Now I'm just hoping my body accepts the implants. I hope there's no further complications. I will post updates to let you know how my recovery is going. If you're interested, please, like, share, subscribe. I will also continue with sharing some, health food, updates. I'm going to be sharing, some recipes that I discovered that are quick and easy, and super chock full of awesome nutrition. And yeah, so I hope you enjoy those. Just do the best I can with what I have. It's all any of us can really do. So thanks for watching, and I'll talk to you later.